Hi, my name is Jennifer Dennison, and I'm a family nurse practitioner student at Maryville University. This is my head-to-toe assessment for Nursing 612. This is our patient today, John, and before we entered the room, I washed my hands. I obtained his height and weight as well as his vital signs. I had him empty his bladder. We checked his near site with the Rosenbaum chart and his far site with the Snellen chart. I also had him change into assessment attire, and then we began. As he entered the room, I observed his gait, which was steady, and his behavior, which appears to be calm and appropriate. We're going to begin by inspecting his head and face. His head is round, normal cephalic. His eyes and ears are symmetrical. There appears to be no lesions, lumps, bruises anywhere. His nose is midline, and so is his mouth. I don't notice any drooping or anything upon inspection. Next, we're going to palpate. First, palpate his scalp. Good. Don't feel any lumps or lesions. Hair is clean and intact, nice and smooth. Give it a little tug and there's no shedding. Also, we look at his eyes. His eyelashes are growing outward, nice and full. His eyebrows are also full, and the facial hair is also intact. Then we're going to take a look. His eyelids are no drainage or seepage, anything like that. And there's no swelling. We're also going to do a couple tests here to test your cranial nerve 7. If I could have you clench your teeth. Smile. Good. Wrinkle your forehead. Close your eyes tightly. And puff your cheeks out. Good. Then we're going to also have you clench your teeth one more time here. Good. And checking for muscle tone there. And this is testing cranial nerve 5. Also to test cranial nerve 5, we're going to do sensation. So if you could just close your eyes and tell me where you feel this.
Forehead, left cheek, right cheek, chin.
Good. Okay. Then next thing we're going to do is have you follow my pen light here. Just keep your head nice and still and follow it. Good, and follow it in. Perfect. All right, there were no extraocular movements, which is good. Now I'm going to have you look at a stationary object behind me. Checking pupillary response, direct and consensual, direct and consensual. Perfect. I'm also going to have you look upward. Sclera is white and moist, and the conjunctiva is also moist and pink. Perfect. All right, go ahead and close your eyes gently, and we're just going to palpate the lacrimal apparatus. Good, and no pain or tenderness?
No.
Good. Now we're going to follow the red reflex. Okay. You can just look straight ahead, okay? Good. And I use my right hand and right eye to look at his right eye, and the same with the left. All right, and those tests, cranial nerves 3, 4, and 6. And now I'm going to test your peripheral vision, which is cranial nerve 2. So if you can just look straight ahead, and I'm going to move my fingers and you tell me when you see them.
No.
Good.
No. No. No.
Good. All right, and your ears are symmetrical. They're even with your eyes, which is good placement. I'm going to palpate the auricles. Do you have any pain or tenderness?
No.
Good. All right. We're going to test your hearing. The first test we're gonna do is I'm gonna whisper a word and you tell me what I said, okay?
Apple.
Good.
Orange.
Good. All right, and that's the whisper test. Now we're gonna do the Weber test. Tell me where you hear this.
Both ears.
Good. All right, now we're gonna do the Renee test. So I'm gonna put the tuning fork on your mastoid process. When you can no longer hear it, tell me. I'm gonna move it in front of your auricle and you tell me when you can't hear that any longer either, okay?
No. No.
Good. And that's cranial nerve 8. Now we're gonna take a look inside your ears. Good. The ear canals are clear and the tympanic membrane is a pearly gray with no fluid present. All right, now we will move on. Look at his nose, it's midline, symmetrical. I don't notice any drainage at this point. I'm gonna have you look up a little bit. Septum is straight and midline. The hair is evenly dispersed in both nostrils. Nasal mucosa is pink and moist. Turbinates are round, moist, and pink. And no drainage is noted. Okay. And then I'm going to have you hold your finger over each nostril one at a time and take a nice deep breath in. Good. Okay, and nasal patency is there as well. And the sense of smell is cranial nerve 1. All right. We're going to go ahead and move on to your mouth here. John's lips are pink and moist, no cracking evident. I'm going to have you go ahead and open up. Okay. Buccal mucosa is pink and moist. We got the hard palate, soft palate, anterior, posterior pillars. And tongue is moist and pink. Have you lift your tongue here? Floor of the mouth. And then we also have the posterior pharynx. And I'm gonna use this here. You stick your tongue out. Say ah. Good. And the uvula goes up and down. And then we're also going to do the gag reflex real quick here. Good. And that tests cranial nerves 9 and 10. All right. And then, also while we're in here though, we gotta take a look at your teeth. They're very straight and white. There does not appear to be any missing, and there's no chips or any crowns, anything like that. Okay, so then we're gonna start looking at your neck. Just inspecting, we don't notice any lesions, lumps, anything abnormal. The thyroid is not visible upon inspection. All right. Then we're going to palpate. See the tracheal placement. Good. And carotids one at a time. Good. And then I'm just going to have you face that way a little bit. And we're going to check the thyroid here. If I can have you swallow. Good. All right, go ahead and sit back. And now we're going to palpate the lymph nodes. So first we'll do the occipital, post-auricular, pre-auricular, tonsillar, submandibular, submental, And then we're going to do superficial cervical chain, posterior cervical chain, and deep cervical. And then the supraclavicular. Okay, good. Now we're going to auscultate the carotids, and the thyroid. Hold your breath for me, please. And hold your breath. Good. And we're making sure there's no bruit there. Now we're going to take a look at the upper extremities. So we're looking at the hands, arms, and shoulders. First, upon inspection, there doesn't appear to be any lumps or lesions. There's a few scattered moles that look normal. We're just going to feel for temperature here. And it's warm throughout. Don't notice any swelling, lumps, or lesions, any tenderness.
No.
Good. Squeeze here and check for capillary refills, brisk. Check for any clubbing, nothing is noted. Good. Now we're going to assess your pulses. Radial. Good. Regular and strong. And brachial. Also regular and strong. All right. Now we're going to go ahead and do your abdomen.
Do you lay down?
Yeah, go ahead and lay down for it. Actually, before you lay down, let's actually have you turn towards the window here. We'll go ahead and do your back first. So first we're just going to inspect the back, look for any abnormalities. Usually we would want them to completely have their back open. There's a few freckles and moles that look normal. So we're going to palpate the costovertebral angle. Any pain or tenderness?
No.
And we don't notice any lumps or anything like that. Then we're going to percuss. Any pain or tenderness on that?
No.
Good. Now we're just going to observe the lung expansion on respirations. Good. And then we take a nice deep breath in and out. Good. And we're just watching for the expansion there. Every time I touch your back, if you could just say 99.
99. 99. 99. 99.
Good. And we're checking for tactile firmitis with that. All right. And now I'm going to have you take a nice deep breath in and then out. And after you exhale, I'm going to have you hold it, okay? Okay. And you're going to mark here. Now go ahead and breathe normal. And when you're ready, I'm going to have you take a nice deep breath in and hold it. Good. And then you want there to be 3 to 5 centimeters in between there, and that's the diaphragmatic excursion, and that's making sure that his lungs are expanding well. All right, now we're going to auscultate. Then have you take nice deep breaths in and then out, okay? Go ahead and seat back here. Take a couple more deep breaths in and out. Now we're going to inspect the chest, which normally we would want to have this be bare also. There is some chest hair which is evenly dispersed. There's a few moles that are normal. And then we're also just going to check the respirations, make sure everything is normal. Wonderful. And then we're going to begin palpating. Make sure there's no tenderness. Okay. Check the precordium here. Any heaves or pulsation. Good. And the apical impulse. Good. And then we're also just going to percuss. And everything we want to do bilaterally. Okay. Every time I put my hands on your chest, if you can just say 99 again.
99.
Good. And again, we're just checking for the tactile firmitis from the chest. Okay, we're going to check the infracervicular nodes here. Good. And the axillary nodes. Good. Now we're going to listen to the heart sounds. Start with the aortic. Move to the left for the pulmonic. And Erb's point. And tricuspid. And mitral. Good. And the heart sounds are regular with S1, S2, no murmur present. Now if I could have you lay down here so we can take a look at your abdomen. Your head down here. Good. Alright, first, let me just have you have your hands to the side here if you can. First, we're just going to inspect. Look at the contour. We want to get on head level. Make sure his abdomen is not distended. There's no visual lumps, lesions, any abnormalities. Then we want to listen. We're going to listen for bowel sounds, clicks and gurgles in all 4 quadrants. Good, and those are active. We're also going to listen to the arteries, the aorta here. All right, and the renal arteries. Iliac. And then the femoral. Good. Now we're going to percuss the right side. We're going to percuss the liver over here. Good, and we just want it dull here. And the spleen. Good, now we're just going to do light palpation for the abdominal muscles. And then we're going to do deep palpation. Feel for any aortic pulsations. Good. And then this is going to be a little deep here. Try to stay nice and relaxed. The liver. You should just be able to feel the border there. And then the spleen on the left side. Good, and you can just feel the border there. And then the kidneys. Stay nice and relaxed. Good. Good. Alright. Then we're going to have you go ahead and scooch back if you can. Good, and we're going to check out your legs here first. And the hair is evenly dispersed. There's no scarring, lesions, lumps, anything like that. Same with the feet, looks good. Now we're going to just feel for temperature. It's warm throughout. Palpate. There's no swelling present. No issues. We're going to feel the pulses, the popliteal. Posterior tibial. And the dorsalis pedis. Good. All right, you can go ahead and turn back around here. And we're going to check your reflexes, okay? So, first one is the brachial reflex. Go ahead and stay nice and relaxed against me here. And we're going to hit my thumb, okay? Good. And then we're going to do the other side here. Go ahead and relax on my arm. Perfect. Good. Okay, and then we'll do the knee. Good. And then we're going to do the Achilles tendon. Good. Good. Those were all within intact. All right, and then we're going to do your muscle strength. So if you can have your arms straight out for me. Push up nice and hard. Good. Down. Good. Legs out. Good. And legs in. Good. Now the last thing we're going to do is if you can stand up, face the wall, and bend down and touch your toes. Perfect. And we're going to check your spine here, starting with your cervical, thoracic, and lumbar. And there's no abnormal curvatures. Perfect. Go ahead and stand up for me. And that'll be the end. Thanks.